We begin tonight with the rising costs of health care for inmates. It's something that you may not realize is provided at the Nueces County Jail.
Officials say many inmates arrive with medical issues, including addictions, injuries, all needing to be tended to before they can be housed there in the jail. Our Brandon Schaff joins us now in studio with more on how the county is addressing increased costs while maintaining those services. Brandon?
Hey, good evening, Mike and Leslie. Well, there are about 1,000 inmates at any given time between the Nueces County Jail and the McKenzie Jail Annex. Healthcare services are available to them thanks to a contracted provider of medical and mental health care, but costs for those services are on the rise.
When I became sheriff 6 years ago, the annual cost for medical and mental and pharmacy and everything involved in our jail services was about $3.5 million a year.
Nueces County Sheriff J.C. Hooper said that inmate health care services costs increased significantly over the last couple of years. A new contract between the Nueces County Hospital District and Nueces County raised this year's budget from more than $4.5 million to $5.8 million. After the previous contracted healthcare provider went out of business, a new provider stepped in about a year ago. Hooper said that he was told inmate healthcare costs were expected to increase regardless.
The writing was on the wall. It was going to happen no matter who the provider was going to be. And the current provider is doing an excellent job and just doing exactly what they're supposed to be doing for inmate care.
It requires nurses and staff trained for that environment, mental health resources, and medications for health conditions like HIV. There are also dental services in the jail. HIP explained that the previous healthcare provider going out of business reflects the need to keep up with rising costs.
That's indicative of just the price and nature of healthcare that it has to be kept up with.
The inmate healthcare services budget is determined on a year-to-year basis. HIP said that it's intended to help them transition from the old provider to the new one.
That allows us to make adjustments as we go along to keep up with the cost of providing medical care, both in terms of staffing, medications, equipment needs, etc.
And HIP says that after this year, the hospital district and county will consider a longer-term fixed price contract. Costs this year would provide a basis for determining how they move forward and provide these crucial healthcare services. Mike, Leslie.